I see the room is slowly trickling in, but I know our home audience joining us online is seated and ready for us to roll. So I think we should continue. Good morning to everyone, whether you're in the room or joining us from home. And I want you to be welcomed rather, to what promises to be an exciting, future-focused session on how digital technologies can drive equitable access on essential public services. We're talking education, we're talking public health, and we're also talking infrastructure. The future, ladies and gentlemen, is indeed here. Digital transformation is already reshaping how we learn, it's reshaping how we care for our health, it's also shaping how our cities are built. So today, with my panel members here, we will be sort of exploring how we can ensure that these advancements benefit everyone and not just a few. So just to give you like a synopsis of what our session today will be about, we're really going to be exploring what are some of the real-world examples of how digital technology enables this equitable access we always talk about. And together with our panel members as well, we will be exploring some of the practical applications and the practical solutions. But we won't just be sitting, and listening. We encourage you to participate, we encourage you to collaborate, and also have fun. Technology is not this dark and scary world. It can also be fun if you explore and take the time to learn more about it. We're joined by a fantastic group of experts who are sitting here on my left, and they are at the cutting edge of these fields. And today, as I opened, I said we will be discussing how these digital solutions can close the gap in access to education, in access to health, and also infrastructure. I want to first welcome Mark Horner. Mark is the Director of Impact and Learning at Siyavula Foundation. Siyavula is a free platform that is focused on maths and physical sciences. And following Mark, we'll have William. William is the Director of Impact and Learning. William is the founder of Vula Mobile. Vula Mobile is a software that connects health workers. It's really some incredible work that they're doing there. And last but not least, we have the beautiful Phemelo, who is from GCRO, which is the Gauteng City Region Observatory. And what she'll be talking to us about today is how spatial validation framework of expenditure in the Gauteng Province Department of Health. Ladies and gentlemen, what can I say? The future indeed is here. But before I ask Mark to come up, I want this to be engaging. I want this to be interactive. And your input does matter. So make use of Slido, as you've been in the past couple of days, which is our interactive polling and Q&A tool, to ask the questions and share your thoughts throughout the sessions. And to kick things off, I want you to imagine that it's 2035. Let me say 2035. You wake up in a world where, digital technology has transformed every single public service. I know. What's the one service that's been revolutionized for everyone's benefit? I'd like to hear some of your fantastic ideas. Any takers? What would you think should be digitalized in public services by 2035? I'm going to start picking on people. There you go.
The department called DRCO.
What exactly?
It has to, DECO, basically, they provide your compliance, basically, which is used by all the other countries before you can leave. And if I can give a simple example, I gave an example on Monday, but I'll give it again. So if any of our students here decide they want to go work in Asia, they're going to have to go and get a clearance certificate from the police station. Then they're going to have to go get their SACO certification done. Then they're going to have to go to DECO to get that approved. Now, the certificate from a police station takes 6 weeks. SAQA takes anything between 2 and 6 weeks. DECO themselves takes a few months. Then if something is wrong, you have to start the process again. And then if you have to apply, you'll have to start the process again. So the experience that I've seen with DECO, it took a year and 6 months for someone to get the clearance certificate before they can go get the job in Asia. Because then by the time DECO finishes, your police clearance is expired because it's only 6 months. Then you have to start again, then you go SAQA, then you go DECO, and that process can be long. So if you're looking for a job in Asia, know that it can take you at least 6 months before you get a clearance certificate from DECO.
Sure, yeah, no, I think that's incredible. Definitely technology can help shorten some of these processes that we have to go through. And let me take one more hand before I bring Mark to the podium.
So, for me, it's Home Affairs.
I think we can all relate.
Yeah, everyone can relate. I don't think I even need to explain, but we're facing most of the same issues, long lines. I'm not going to say bad service, but let's say poor, because in terms of getting assistance, even though you use the booking system, there's still time that you have to stay there. Like, you don't get assisted immediately if your appointment is 9:30. When you get there, and then 9:30 when it hits, you get assisted. You still wait either way. So I think that's something that needs to be paid attention to. Yeah, that's just my point.
Yeah, no, that definitely. But I am aware that Home Affairs is currently doing a modernization project. Maybe keep on the lookout for that. These are just some of the great ideas we're getting from the floor. But let's hear what is actually happening. So Mark, I want you to tell us more about, please come forward, how you're making learning and teaching easy with your Siyavula practice.
Cool. Thank you. All right, good morning, everybody. My name is Mark Horner. I'm the Director for Learning and Impact at the Siyavula Foundation. I think I had some slides, which I don't know if will they come up or not? It's not really that important. I'm just going to use what we do as a case study. Oh, did I do something wrong? Maybe not. Okay, we're good. All right. You may not be familiar with what the Siyavula Foundation does, so I'm just going to talk a little bit about it for a couple of minutes, and I'm going to use that as the basis for some opportunities and maybe a couple of slightly controversial statements just to keep things interesting. So just so you know, we are a mathematics and physical sciences focused intervention, and we've been doing a lot of work. So one of the things that we did a long time ago at the start of the CAPS rollout in our curriculum is write openly licensed textbooks. So there are textbooks that anyone can read on our website completely for free. And then we said if everyone's actually got access to a textbook, that was enabled by technology in the first place, what's the best thing that we can do as a technology organization to complement that? So we looked at the research into cognitive science, and we built an adaptive practice platform, i.e. a platform where you can practice mathematics, physics, chemistry questions. They get marked automatically. We generate the questions using software. You can see the little animation on the right. We generate, let me hold this. I've lost it. Pop it in a pocket, otherwise you won't be able to hear me. We generate the explanatory solutions as well, so students can do as many problems as they want. They get immediate feedback. They get a solution. They can figure out where they went wrong. And there's some stuff from cognitive science about what's the optimal sequencing. So there's some machine learning, but it's not generative AI. I want to distance myself from that right now. Not that that's a bad thing, but we were doing machine learning, then generative AI went crazy, and I talk about machine learning, and everyone thinks we're running ChatGPT, which is not at all what we're doing. So we provide an optimized practice for mastery experience, aligned to the curriculum with textbooks, and then we've had to build a whole motivational framework for learners around it as well to try to get them engaged. This is completely free for all learners anywhere in the world, in fact, and we're expanding to 6 other African countries, but we've been operating in South Africa for over 12 years now. And I'll just give you some idea. The free textbooks, read on mobile phones, are read by more than 50% of the learners who take mathematics and physical sciences in high school every single year in South Africa. We monitor that. We can see that what they're reading and when they're reading it correlates with the government's annual teaching plan or the pace setters from the provinces. You can see how long they're taking. There's a lot of data there. It's very easy. But there aren't that many kids that take maths and science, unfortunately. So 1.5 million learners to 1.8 million learners every year just read the textbooks on their phones. We've got over 30,000 registered teachers and over 8,000 educational institutions using the platform. It's completely free, as I said, and that was a change for us. But let's talk about having a real impact in our context. Yesterday there were talks that mentioned the quintile system for schools. I assume everybody in the room knows what those are. So 50% of the students from schools on our platform in South Africa go to a quintile 1, 2, or 3 school. Now, when you talk about a technology solution in education, everybody says, how are you going to get to the kids in rural areas? So 400,000 learners registered to use our practice service. I realized on the plane that that image was a little bit off to the right. So that's 400K learners in 2023, and we're over 500,000 this year. That's what's missing, and 50% from the no-fee school bracket. But it's because our platform is zero-rated on MTN, Vodacom, and Telkom. Not all mobile networks, but we have had times when bad actors, as we like to say, attacked our website for whatever reason, I don't know, and we had to turn off certain things that enabled our zero rating, switch servers around, and the zero rating disappears, and our traffic drops by 70%. So most of our traffic is enabled by zero rating of our platform. So hundreds of thousands of high school learners every year using the platform. We've measured their results. They absolutely improve. So that's just an EdTech solution delivered over mobile phones that gets to hundreds of thousands of learners in a rural context. And you want to weigh that up in the context of, well, do we need broadband? What infrastructure are we going to have? What's mobile penetration in South Africa like? What's the mobile networks versus fiber networks? Things like that. But, so that's the basis for what Siyavula does. I'm not saying that we're special, it's just I can speak with confidence about what we do. But there are some things that we can highlight in this that I think are quite interesting. So the website for this conference said that we should talk about how, or it said the conference is about how governments can leverage technology and data analytics to enhance their operations and improve public services. So here's some comments I'm going to make. No one asked me to make these, so this is of my own accord. So firstly, I've mentioned the zero rating. With the new 5G rollout, ICASA regulations changed. All mobile networks will, it says they're going to take 3 years to implement it, which I'm upset about, will allow public benefit organizations to be zero rated. So that's a way to decide who's special. Public benefit organizations are tax-exempt non-profits in South Africa, and they've been vetted by SARS and other bodies already, and they will be zero-rated. We can get to the majority of high school learners today if we leverage mobile phones. Siyavula's story about why we're zero-rated involves talking to each mobile network for many years, running projects. It's complicated. We have a regulatory framework that says all public benefit organizations should be zero-rated. Now we're just trying to get it implemented. So we can get to them. The second thing is kids do hundreds of thousands of questions, millions of questions every year. We ran a baseline assessment, systemic test with Gauteng Department of Education, where 27,000 learners, 160,000 learners were supposed to do it. So we recognized the challenges of getting the kids to actually do something, but it was walk into a lab and do a test for an hour. No kids want to do that. I don't know if anyone likes writing exams. Taking a grade 8 learner and telling them they got to write an exam for an hour in the first week of school definitely sucks, and it doesn't create a fun experience. But kids practice on Siyavula, and we use the same questions. But with 27,000 learners worth of data and millions of questions, we can look at what does the baseline assessment results on certain items look like? And if we just look at when learners do those questions for the first time, when they're practicing for formative assessment and learning, the results are statistically indistinguishable. We don't have to have kids sit and write an hour-long test. We can just use historical data for aggregate information about baseline performance. And things move so slowly in the school system that nothing happened between last year and the start of this year that's going to change those results. We don't have to do. There are ways to do systemic tests that don't even interfere with classroom and learning. Then we want data the Department of Basic Education needs data. Let's not even say they want data. They actually need data. And if there are over 200 edtech companies in South Africa, and that's without a policy framework that enables them. Currently, we have no proper digital strategy for the country in the education sector. They're working in schools, and they're all taking records, data records. And there's no way for us to share data with the government currently. But we've got a federated, distributed system where there are hundreds, thousands of people collecting data over mobile phones and things like that, where the government could specify how they should submit an assessment record, and we would all happily send it. We send a spreadsheet to every single province and the national ministry every month with usage by school, teachers, learners, etc. There is a system of data collection out there that exists, and no one's leveraging it. There's no way to submit data to SASAMs. There's no way to submit data to DBE. DBE doesn't need to come up with the rules. They just need to say, send us records like this. We would know how many kids are doing English or maths, etc., for how long. And the last one is, we see that we get the best engagement, the best learning, when there's a motivated individual in front of a group of learners. And we spend a few billion rand every year at the moment on the Presidential Youth Employment Initiative. And sometimes people don't know what those youths should do. Well, they could have kids help get the kids, because they're young, they know about phones and things like that. Just half the problems teachers have with EdTech and phones, if they're allowed to bring them, is login details, understanding different versions of Android. Young youth, PYEI youth, are a little bit more comfortable with that. But some of them are even trained, but they are motivated individuals who can help drive learner engagement. And then you just reinforce all of this stuff. Here's some details on Siyavula. Doesn't really matter. I think that these will be shared. I'm happy for it to be shared if you want my details, but I'm done.
Thank you. Yes. Our next speaker is William. He is the founder of the Vula app. And if you go through the website, you'll see the wonderful testimonials that come from the website and how it has saved a lot of transport costs, reduced clinic numbers, and saved patients long and wasted trips. William, over to you.
Thank you so much. Great. Cool. So you might be wondering why I'm here. My name is Dr. Will Mapham. My passion is improving healthcare in rural areas. So I don't know how many of you are from the Eastern Cape? And yay! Okay, cool. This is the road to Mapham Hospital, where I used to work. 3 of us are working there as doctors, serving a population of 250,000 people. So we're very busy, very passionate. We did the best we could do. But every doctor doesn't know everything. You know that many patients travel long distances to get to healthcare. The distance between Nababeep and the Northern Cape to Mbali is an 8-hour drive, which is a long time. Would you drive 8 hours to see a dermatologist or an ophthalmologist or any other specialist? That's the choice that patients have to make. And there have been some tragedies. This is a letter that I wrote myself. So this is paper data. In 2004, the patient had come with an eye condition. I didn't know what it was. And so I said, please go to Mthatha. It's only 3 hours away. And I hope that then he would get the treatment he needed. 7 years later, I went back to volunteer, but now as a specialist, so more data in my head. And he was so excited to see me again, because when you work in a rural hospital, everyone kind of knows you. You're not a stranger, you're not just a doctor. And unfortunately, when I looked at him as a specialist, he had never been to Mthatha. It was too far away. He'd gone blind in that eye. And it was actually a simple condition that he'd gone blind from, just hadn't been treated for a long time. And worst of all, we even had the medication he needed the first time I'd seen him. So a tragic case of a junior doctor not having data or not having a connection to a specialist, and a tragic outcome for a patient. I work in the public sector. This is my passion. This is me working as a public sector specialist. You see I'm seeing patients, I'm teaching students, and more patients are waiting for me to be seen. And that phone in the corner just rings with people like me in the past trying to get some advice. And it's an impossible situation, so what gets missed is the ringing phone. So we had to solve the problem. So Vula is an app. It's also got a web portal, and it's software that connects healthcare workers to solve this very, very urgent problem that we see every single day. And our mission is to get patients to the right healthcare. We started off with one app. We still have one app. It's still going. Vula comes from Vula Mobile, like open your eyes. There are now 37 public sector healthcare workers using Vula or registered on Vula. 1.9 million patients have been helped. And that's very hard to imagine. But I looked at the data. If you all held hands and got all your friends to hold hands, and all their friends to hold hands, and you hold hands until you got to Cape Town, that's 1.9 million patients. And not only is that a patient, each patient now has a digital health record. There's images attached to every single case. And we built our own chat system. Sorry, Meta, and sorry, Microsoft. We built our own one. So it's more secure. And actually, then you got all this chat data about the healthcare workers about that patient. There have been 12 publications so far. I know there's some students in the audience, so please contact us after this to write some more. And the publications all show that there's better health outcomes for patients. Time and money is saved for the healthcare workers, and at the systems level, even bigger changes can be made. But if you can imagine what happened in the past with me writing that piece of paper, most healthcare records are still on paper. But every time Vula is used, those now get digitized. And what we need is diverse data sets from developing countries, because we need to be included in the future of AI. It's not going to happen because we don't do anything ourselves. So I've shown you millions, but now I'm going to show you one patient. So this is a patient where we drove 5 hours to give specialist care to one particular patient. She had been blind for a long time, and this is what happens when one person gets access to specialist healthcare. So we'll play if I press. Will you have to play it, or? Sorry, I think it's worth seeing. Okay, otherwise I can describe it. Hopefully it'll come on. But essentially, this lady had been blind for 9 years. And she didn't even know that it could be cured. Her daughter was a nurse and didn't know exactly what to do. And once we operated on her, she started screaming for 9 years. For 9 years, she's been blind. She's been led around by a family member. And now she has access to being able to see, which changes her life and all the people's lives around her. So while you're sitting here, one patient is helped on Vula every 40 seconds, and 30% of patients no longer have to travel to get specialist healthcare in the public sector. So we're looking for contacts in the Treasury, national or provincial, to make sure that we can implement this at a greater scale. We're also looking to work with students, so please email us on the support email address. And any one of you who's passionate about improving the public healthcare system, please contact us as well. Yeah, thank you very much.
Thank you very much. Thank you so much, Mark. And last but not least, we have Phemelo, who's here to tell us about how exactly are they leveraging GIS knowledge, Google Earth, Pro imagery, and land use to change assessment techniques rather, and to spatially assess the location and existence of government-funded projects and validate project status and progress. Yes. So over to you, Phemelo.
Still waiting on the slide.
Phemelo's ready for her slides. Perhaps while we're doing that, I just have one question for you, Mark. Siyavula has made some great strides, reflected as well by your presentation, around democratizing, access to quality education in maths and science, which are very critical subjects. So what are some of the biggest challenges you faced, would you say, in scaling this solution to reach more learners, particularly the under-resourced communities?
So I think one of the things, just go back to the mission, it's to try to get to as many learners as possible and really champion the love of maths and science. So then you need to worry about those that are in rural areas, lower quintile schools. So the first challenge is the infrastructure. So we sidestep that by going with phones, not requiring that you have a tablet or a PC or something like that. So that's obviously a really big challenge. And then even then you're left with the cost, the data cost. So if you go to students somewhere, learners, and you say to them they must access a website, they're going to say, well, what's the data cost?
Yeah.
And you'll see stuff about data cost in South Africa, so zero rating is really critical. But then if you want to achieve systemic change, you have to align with the schools, you have to align with the government. In rural contexts, learners might walk hours to school and hours home. They're spending most of their day at school. You've got to align with that school system. And so I think the next blocker for us, the current real challenge, is that we do not actually have proper policy around the use of digital products in schools. There's no national vetting, never mind procurement. So then there'll be sustainability, but grant funding will help us. So we don't have a good policy around how to work with it. And then teachers, therefore, rather than seeing educational technology as solving their problem, like in Will's case, it saves them time, they see it as increasing their burden because they feel like because there's no digital policy and digital assessment isn't accepted, they have to do everything on paper. So they might tell their learners to go use their phones and stuff, but then the district official is visiting, no, we're going to switch back to paper. So they feel like they're duplicating work. And so policy, if we could just get the policy right, we could actually unlock a huge piece of scaling. And then the positive reinforcement, as I said, is if that data can get fed to the Department of Basic Education effectively, then we've created this really great virtuous cycle.
No, definitely. Thank you for that. So it's not only education that's the key to success, policy as well is the key to success to some of these initiatives. Phemelo, are you ready for us?
Ready.
Over to you.
Okay, good morning, ladies and gentlemen. My name is Phemelo Mahamuza, and I am from this lovely institute called the Gauteng City Region Observatory. And basically what we do is that we provide support to also government. So when they knock, we respond. So a few months back, the Gauteng provincial government, specifically the Office of the Premier, came to the GSCRO and they gave us a data set. Now, I know we love the fact that we're always requesting data from government, but the main question is, how do we deal with that data set? The specific data set in question was actually the infrastructure reporting model. So what this model had was infrastructure project locations, the start dates, the source of fundings for different departments within the Gauteng provincial government, ranging from health to road and construction to human settlement. That is just a little overview of how the data set looked like. So now the main question is, having such a dynamic data set, how do we visualize it? How do we validate it? And how do we represent it? Many studies have chosen to spatially locate where these healthcare facilities are, ticking the boxes that healthcare facilities are within high-populated communities. Also that these new healthcare facilities that are constructed are within the outskirts of the Gauteng province. We can further give nice little shiny stats that says that from these healthcare facilities that were constructed, 90% of them are within close proximity to informal settlements and townships. We can also say that the government is providing healthcare to both registered and unregistered townships. We can even take it a bit further to say that even our mushroom informal settlements are provided with healthcare services. But it still does not answer the question, is the infrastructure there? Is it ready to use? And how long did this infrastructural development take? Okay, so that is just basically the index that I used for the previous slide, just browsing through. So the data set looked like this. Now the IDMS gate is a reporting system that they use to tell us how far into construction is this individual project. Now one can wonder, but the Phemelo clinic is still at stage 1, but the closing date says that it was completed in 2022. Then we can also look at other projects like Kagiso, community healthcare facility, which is still in its design and implementation, but the closing date says it was completed in 2023. So then, how do we validate this? How do we make sense of a system that to some extent is a bit outdated? We start looking at it from the ground up. And from the ground, I mean the literal ground, construction stages. With main questions asking, what insight can the information from the infrastructure report tell us? And how can we digitize and make the reporting system more technology-driven, I guess, for lack of a better word. So, several studies have alluded to the fact that when we're looking at healthcare, we're usually looking at the quality of healthcare and the service itself. But little to most times do we actually look at the construction process. And even when looking at the construction process, do we actually go back in time and check, did we meet the mandate? Did we meet the deadlines? Barely. Remote sensing has become a fundamental tool when studying and understanding the land surface. As satellite imagery continues to improve, with drone imagery being one of the new latest technology, we can actually use this to classify, to delineate where our new healthcare facilities are. But most importantly, we can locate the construction process from the initiation stage till the final stage. And that is just basically the history of satellite imagery. I will not bore you with it. So, as we know that remote sensing basically involves the gathering of information about the Earth's surface based on what is reflected, detected, or emitted. So now you're wondering, okay, Phemelo, but the Earth's surface is so dynamic. There's a lot of features. How do you plan from going to integrated data to extracting building areas? Now that is where the application of machine learning comes in. Now I'm very glad that Prof decided to give a little talk on what machine learning and AI is, so I will not be doing that. But I'll be telling you that for this specific project, for us to be able to detect where these healthcare facilities are, we will be using a method called object-based classification. Now basically what object-based classification is, it is a meaningful way in which we are able to delineate different objects according to their spectral and spatial characteristics. And by spatial characteristics, basically it's just like association. Okay. Now, back to everybody's favorite thing, the machine learning algorithm. So for this specific model, we use the support vector machine classification. Now, not to bore you yet again with the nitty-gritties of the model, but basically what the model does is that, as Prof mentioned earlier, that a model is only as good as what you train it. In the previous slide, we saw that each building was delineated, or for the better correct word, digitized. And here we considered different shapes, different structures, different spectral reflectance, taking into consideration texture, color, location. And that's how we landed to this. So what this model basically does is that it classifies by creating a hyperline. So based on the characteristics that we feed the model, it is able to determine that, am I a building or am I not? And if it's not a building, we read it as unclassified, because remember, we only care about the building. Right, so the satellite imagery is used for this project. We used the Maxima technology imagery and the Airbus imagery. Now the reason these ones were very exciting to me was because of its spatial resolution, 30 centimeters. We've come a long way, so why not use it? Okay, so back to digitizing. Buildings were digitized using the GIS scenes 3D model. We were able to detect the length, the size, different shapes, location of these healthcare facilities. And remember, if it's not a building, we don't care about it, it's not classified. The model was then trained with our input data being the digitized healthcare infrastructures. It was then split to a 30/70. Sorry, here I was trying to bring my code to life, so excuse me for shabby. Yes, so the model we trained it with was the support vector regression model, and the kernel that we used was a radial-based function. So basically, the kernel is that hyperline. So the reason we used the radial-based function was because of multidimensionality. As you know, that satellite imagery is not linear, so yeah. Okay, after the data was trained, our output model was basically a land cover classification, which was able to extract buildings everywhere. So we trained here randomly. The buildings were trained at random, so it wasn't necessarily focused on our healthcare facilities, but what we wanted to get is the feel, the structure, and the shapes of of buildings around us. Now, just to give you a little overview of how it looked, we will look at an example of the Green Parks Healthcare Facility, which was constructed in 2015. So if we validate what the model is outputting with actual live satellite imagery, we can see that in 2015, there was no healthcare facility constructed. But in December 2023, it proves that what the model reads as a new building is actually there. So we were then able to validate that truly the healthcare facility was constructed, and it was constructed on time. We can also use satellite imagery to check construction phases across time. This can be done through temporal analysis, where we look at spectral imageries, specifically the red, blue, green region of the electromagnetic spectrum, to analyze construction over time. Now, results are not always pleasing, unfortunately. So what this data set showed us that from the healthcare facilities that were funded by the Health Facility Revitalization Grant, only a good 7 of these healthcare facilities were actually completed or close to being completed. The data set was also dynamic enough in indicating to us that some of these structures that are recorded as new were actually already existing healthcare infrastructure. So that can either be that the reporting system itself did not categorize it properly. We don't know. And then the model was also dynamic enough to show us that in some healthcare facilities, nothing was ever constructed. I'm sorry. So if we're looking at an example of healthcare facility F, which is one of the ones we healthcare, nothing ever happened. And if we look at a close at the satellite images, we can see that the start date was 2012 and the end date was 2021. But we can see that something happened. There was activity on site, but construction never happened. But now this goes back to one of the major problems about the reporting system itself, which is properly geolocating our healthcare infrastructure. So as you can see, this is where the healthcare facilities are supposed to be developed. Instead, a pre-existing healthcare facility was upgraded, as you can see in 2012, how it was in 2022. Now, looking through different images across time, it's time exhausting. So the model was able to detect if there is a healthcare facility, and if there is, then we can go back and check how construction took place over time. So some of the lessons that I learned from this is, firstly, when it comes to the framework itself, the importance of actively and correctly geolocating our healthcare facilities. Secondly, machine learning is great, but unfortunately with satellite imagery, the greater the spectral resolution of our images, the better the quality. But most importantly, most imageries that are open source do not have the perfect spatial resolution. So doing this does mean that more investment has to come in funding, maybe our own satellites, or the use of drone imagery technology to achieve such models. And last but not least, it is important to automate infrastructure development through assessing it, as we know that the initial aim of this project was, how do we provide evidence-based solution? Through this model that is able to detect construction, I do believe that we are able to do great things, but the most important thing that I still outline is the better the satellite resolution, the better the imagery, the better the model. Thank you very much.
Thank you. Thank you, Phemelo. I did say I am here, and I promised you an exciting, future-focused session on how digital technologies can drive equitable access to essential public services. And we had 3 live demonstrations by our panel members here, portraying and illustrating how they've gone about doing this.
Thank you.
I have a question for you, William, specifically on the Vula Mobile. Mark mentioned that they have zero-rated the Siyavula app that makes learning and teaching easy. I'm just interested in understanding with the Vula app, and how it has had the significant impact in connecting healthcare workers across different regions. Can you perhaps maybe share a specific instance where the app has drastically improved, healthcare delivery in rural, underserved areas?
Yeah, I think there have been a number of examples at different levels. So one example, there was a child who had there's a technique to use when you have a burn injury to your eye. And if you do it immediately, that person will have their eye saved. If you don't do it immediately, that person will end up in rehabilitation and probably lose their eye. We tracked a case where a patient with a burn wound was taught, or the doctor was taught, how to manage that case. And we thought that's a good example. However, that doctor then taught all the doctors in Khayelitsha. And then they started making much better referrals. Patients didn't need to go through because they were being treated straight away.
Oh, wow.
So that was a nice one. And then another example, sort of slightly higher level, was a nurse in Vredendal And she learned case by case by case. Every time she made a referral, she learned something. And then one day she stopped referring, and we panicked because maybe she had an accident. We never met her, but we were worried. But when we phoned her, she said she's fine, but she knows what to do now.
Oh, wow.
And then she used the data that had been collected all that time to demonstrate to the Department of Health why there should be a better clinic in Vredendal. They motivated for funding from the Japanese government, and now in Vredendal, there's one of the most amazing clinics you can get. So I think that's the power of, if you do have data, you can make systemic changes.
If you do have data, you can make systemic changes indeed. And last for you, Phemelo, I'm just interested, you showed us this amazing work you're doing, with, GIS. But I also just want to know, what are some of the challenges you're facing, with regards to gathering and using the spatial data to influence health policy, and expenditure decisions? How do you address some of these gaps and the inaccuracies in some of these frameworks?
All right, thank you very much for the question. So I think just bringing it back to what Prof says, that a model is highly dependent on how we train it. And the data set itself is way more important. So with government, more of their reporting system is actually paper-based. We see little to no information about how they actually validate or how they assess these construction processes a long time. And one of the most things that came up during the meetings was that constant monitoring is not plausible for them. So then the question to me was, how do we then make this so effortless that you don't even need to leave your office? You don't need to leave your home. But with that being done, as much as machine learning is so dynamic and whatnot, specifically when we're looking at satellite imagery, the need for high-resolution satellite imagery is of the utmost importance. So we can train our models with these different images, but unless the image is high resolution enough, basically, to allow us to categorize these healthcare facilities, I think that's one. So I think when it comes to investing in modeling of infrastructure, I think that's one thing that we can look at. But I feel like the overall conclusion of the project is that we can get a better aspect of how the money is being spent. Mm-hmm. We got to see that where existing healthcare facilities were, which now begs us to question that, is this a misclassification? Should it have been maybe at upgrade? Or is there something that we cannot explain? Mm. And then when we're looking at sites where there was no healthcare facilities, it now begs the question to say, the process of site suitability analysis, is it effective enough? So I think those questions can kind of cut to future projects to say, how do we spend our money and how do we not waste time with certain things? Mm. And I believe that with satellite imagery, we are able to answer those questions as to, is it the perfect site? Is it in a high-risk area? So yeah, I feel like that's how we should start looking at spending in a more spatial perspective, because at the end of the day, you're building it at a certain location.
Yeah, no, thank you for that. And I think just before I open to the floor for questions, I do encourage my three panelists here to just engage on Slido, because there are people that are keen to learn more about some of the work you do, and for them just to know how they can get a hold of you if they want to do more work in the spaces that you're covering in. I'll now hand over to the floor just to see if there are any questions. There were claps, there were ums and ahs. So I want to know if there's any, I don't know. I'm going to ask for some help on the floor. Maybe Donald over there?
Thank you, and thank you to all the presenters for their very illuminating presentations. My name is Donald Onyango from Gauteng Treasury. What I'm curious to know, and I must admit that sometimes I'm a little bit behind the curve technologically, there was a slide you showed, Phemelo, where there were 3 images, 2012, 2018, and 2022, of a site where a facility was supposed to have been built. And we know that technology improves all the time. So the images that were taken in 2022 were probably much better than what was taken 10 years earlier. But what I'm curious to know is there a repository where you go and get satellite images of a particular location that go many years back? Because I would be curious to know how it was that there was no site, there was no building there, and then 10 years down the line you can see that there was some work there and then no work done. But I'm very curious to know how that image from 2012 was obtained if this work was done fairly recently. And then, of course, the issue of the project lists that are in the IRM, I know that the colleagues who are responsible for infrastructure were actually in the process of cleaning up the project lists, and those kind of anomalies where projects are in identification stage when they've actually been completed is probably something that should not be there anymore. But thank you very much.
Thank you, Donald, for that question. Perhaps you can take 2 more questions, and then I'll allow our panel members to respond.
Lungile Cindi from Treasury, Gauteng Treasury. Mine is on the Siyavula platform. It's quite exciting, I think, because I've also just done community projects on education, partnering with sports people. So I wanted to find out, you indicated that obviously for it to even work better, you need people who are enthusiastic about, being on behind the scenes for the kids to actually interact with the material. How have you engaged with underprivileged communities to find those people? Because I know that people who do a lot of tutoring work, but on a physical level, and it becomes difficult to find the time, to find the spaces, and to actually travel the distances. For instance, I used to travel from the East Rand to Soweto on weekends, so once a month wouldn't be, that impactful. But with this platform, being there, having people who want to do the work and who know the people that they can even extend your reach with this platform. I think I wanted to find out how you've engaged communities on that level. And on the Vula Mobile one, I wanted to find out, is it connecting just on the public service, or are you also connecting health workers from the private sector? Because I know there are some private sector health workers who've worked on the public service, but who can actually use this platform. I just wanted to also indicate my next stop from this conference is a public hospital. I'm visiting a family member there, so I want to make sure that I literally have information to just share when I get there, because as much as we work for these organizations, we still connect with people at that level. Some of our family members use these services, and we need to make sure that we really get this information out there.
Yeah.
Thank you.
Thank you. One last question somewhere at the back, then I'll allow my panelists to respond. You can go ahead.
Oh, thank you for the presentation. I just have one question on, I'm not sure if it's a question actually or a recommendation on Phemelo. So I've seen you've shown images of that the first speaker spoke about 2012 and everything, and you mentioned how hard it is to classify those images because they are not clear. And one of your recommendations of what you suggest is that you upgrade the solar systems, of which I think that will take some time. Have you thought of maybe changing the algorithm that you're using or your model, like using the convolutional neural networks, which I think they are more better when it comes to image segmentation and classification instead of the support vector machines? Thank you.
Thank you for that. I'm going to hand over to my panelists. The questions directed at whom. Okay. Just briefly provide some responses to the audience. Thanks.
All right. So thank you so much. So regarding the data set being outdated, unfortunately, when we receive data set, I would say to some extent it is not our job to make sure that it comes correct. We only interpret it based on what it is given. But to discuss that, when training the model, the IDMS gates were never used. And we decided to use the project start date and the project end date to train the model in how it should detect construction over time. So the IDMS gates did not necessarily influence anything within the model. That is just a way they classified. So the model was also basically proving how outdated that classification is. And then regarding historical image, for open source historical images, you can look at Google Earth Pro, where you can go back as far as 1990. And then if you're willing to pay, there are the satellites that I mentioned, which is Airbus and Maximum Technology, where they do offer images at an exceptional resolution. And then another question was changing the algorithm. Unfortunately, you can't change the algorithm. I can use random forest, I can use convolutional neural networks, but how the training is the most important part. So if I'm training it with a high resolution imagery, that is what is important. And as I mentioned, that we've come so far with satellite imagery that we've come from a point of having 100-kilometer imageries to having 30-centimeter imagery. So the model itself, the classification model itself is not the problem, though I would love to try another model, but it is the input data. So what we inputted is what determines if our model will work or not, but not the resolution of the image itself.
Thank you. In a minute, I will ask my two other panelists to just respond to the questions from the floor.
Shall I go first? So that people often think there's a public sector and there's a private sector in healthcare. What we see with the data is that there's so much collaboration. There are even some public hospitals that receive more referrals from private doctors than from public sector facilities. So that already exists kind of in a very collaborative environment. So people are arguing about the NHI at a high level. At the ground level, the data shows a different picture. And I'm not sure where your family member is, but we do have operations at Tembisa Hospital. It's reasonably close by. And if you go to the website, there's a Get Started button, and tell the health worker that's looking after your family member to please fill that in so they can get started on Vula.
Thank you. And last but not least?
So on engaging with local communities or people engaged in sort of face-to-face tutoring, things like that, that is where we've sort of converged. So we've tried many things over the last 13 years at Siyavula, different models as a social enterprise. So we first wanted to make the platform really low cost as part of our sustainability model, but that's all really changed a lot. So the platform's completely free for learners and teachers as well to access, and then there are value-added services that we sell to institutions. That's part of the sustainability. But so in that transition, which has happened in sort of the last 2 years properly, then we're too small an organization. We really try to keep focus on the platform, and so we transition to trying to find these implementation partners, because they're the groups that can drive it. So the truth is, because Siyavula is completely free, we find tutors who actually just meet in a library or at a school or whatever, and they tell the students, the learners, just use Siyavula. They don't need any permission from us. They can register, the learners can register, they can see it. So there's a level of usage that anyone can have access to. Then it's just about raising awareness. But you're absolutely right. And the idea of engaging with implementation partners from individual level to national organizations, tutoring companies, outreach organizations, after-school programs, that's the future for us, but it's something that we're still trying to figure out. So we have a My Future page where partner organizations can be listed, but it's quite a lot of their community organizations. So finding them, and you've got to build a mechanism or try to reach out to them, is something we still really have to do work on, but we call them our academy program or our academy model, this kind of after school. But that's where we get the best results. It can be a motivated parent, a motivated teacher, or someone else. So the motivated teachers that come to us, we call them our Circle of Champions teachers. The motivated after-school program, we call them the academies. We want to have a motivated learners program, which will be the ambassadors, but we're a very small organization. It's a lot to do. But you're absolutely right. Those are the people on the ground that we really need to help. but they can use the platform currently as it is, and there's no data cost, there's no cost to them, there's no cost to the learners. So we need to get to them.
Thank you so much, Mark. We really
can
can
I also
do
say,
more. Yes.
just for all the Gauteng people, because almost everyone said, Gauteng is our best province. So we've got a great relationship with the Gauteng Department of Education, and we've got over 60% of the learners that register and use Siyavula every year at the moment are from Gauteng. Then the rest of the other 8 provinces make up the 40%, the remaining 40%. So GDE is a great partner of ours.
That's great. Thanks, Mark. Well, at least we have quite a couple of provincial representation here. So hopefully after this conference, we'll see the other provinces catching up. Thank you so much to my panel members. They really do say time flies when you're having fun. So I want to thank you for your time and being here and engaging with us with some of this exciting work that you're doing. And really, to everyone else, let's continue working together to ensure digital technology creates a future where no one is left behind. Thank you.